Last month, the US welcomed a new administration, one led by Donald Trump, who made it clear that he was determined to cut funding to many programs, particularly those run by USAID. These include health programs that are considered vital in the third world. Mpox outbreak in Uganda was backed by one of those programs that was intended to support treatment and vaccination. Without this support, the patient numbers continue to shoot up, raising increasing support. The USAID funding cut has put Uganda's response to the outbreak in jeopardy. In a bid to fill the funding gap, Uganda has turned to the World Health Organization and IGAD for support.
As WHO, we are available to work with this project in terms of technical guidance, and we are also, as an entity working on the pandemic fund, available for monitoring and evaluation of the implementation of this work. And one comment I would like to add is, as there is flexibility in doing this project, and IGAD has discussed the flexibilities with the government of Uganda, it is important that we also focus on areas that we don't have to repeat with the next outbreak, and that is strengthening the resilience of our systems and the different components of our health system.
The World Health Organization already provided guidance and support to Uganda in its response to the outbreak, and IGAD has also pledged to provide assistance.
Uganda has been a member of IGAD since 1986, and we do recognize that pandemics such as Ebola, Mpox have cross-border dimensions. We look at this as a regional shared challenge. Therefore, in line with our mandate, we are here to work with government. We are here to identify the needs, to see where the pressure points are, so that working with partners such as WHO, working with partners such as IFRC through their national Red Cross and Red Crescent societies, and then also benefiting from the support that has been put to our disposal by the World Bank through the Trust Fund for pandemics, through the program we call PREPARE, which is pandemic preparedness and response. We've been able to mobilize up to $4 million to support the pandemic in the region, particularly starting with Uganda, where many cases have been reported. It's not lost on us that people are dying. It's not lost on us that the risk of this pandemic spreading is high, if not arrested. Therefore, we are happy to be here to support all the national efforts that are geared towards arresting this problem.
IGAD has been supporting Uganda, especially on cross-border issues during pandemics, and also supporting refugees, knowing very well that Uganda hosts a large number of refugees. And to date, we have nearly 1.8 million refugees in Uganda. So we want to say a big thank you to IGAD.
With the funding cuts, all USAID directly hired personnel were placed in administrative leave globally on February 7th. The only exception are the designated personnel responsible for mission-critical functions, core leadership, and specially designated programs. USAID had set aside a budget of $50 billion in funding to be channeled as foreign aid to countries in Asia, Africa, South America, and the Middle East. It remains to be seen if the alternate funding will properly cover the gap left behind by the US.